Are you looking for some more volume in your breasts? Are they hanging a little low and you want just a little lift and you don't want to go through surgery? Well, I have a non-surgical way to get a breast lift, and I'm going to show you what that is. First, we're going to inject PRP, which stands for Platelet-Rich Plasma, into our patient's breast to help give them some more collagen naturally. And then we're going to do PDO threads that will actually pull her breast up and at the same time make her make collagen naturally. So I'm going to show you the process. First, we've already numbed up her chest with numbing cream. I have spun down her blood and I have got her platelet-rich plasma right here. So we are going to inject, I've already wiped her off with antiseptic as well. So we're going to do 2 areas of injection of the PRP and the rest we're going to inject the platelet-poor plasma. So are you all set? Mm-hmm. Okay, so ready? 1, 2, 3, here we go. So this is our first injection spot for platelet-rich plasma. And the way we get this is we draw blood, we spin it down, and then we spin it again. And we concentrate the platelets 5 to 7 times. So it's a very concentrated concentrating PRP machine or centrifuge that we use. And not all centrifuges are made alike. So we have a very specific centrifuge that is top of the line in the aesthetics world here. So she will notice today that she has got extra volume from the PRP, and then her body is going to absorb it. And so in about 3 or 4 days, she'll be like, oh, where did it all go? And that's because all the PRP gets absorbed and then they start doing their magic. And what they do is they call to her stem cells. Okay, one more poke up here, okay? 1, 2, 3. They're going to signal to her stem cells to migrate here to her breast area, and then her stem cells don't know what they're going to be yet. So they actually become what the target cell. So stem cells love to become adipose cells, and our breasts are made of mostly adipose cells. So this is especially good for breast lift. And so they'll become new breast tissue, but it's going to take 3 or 4 months. So it doesn't happen right away, because you got to think about the time it takes for a cell to develop into a new type of cell. So it takes 3 or 4 months, and then she will have more natural fullness up higher, and it'll help pull up her breast. And she could even increase size of her breast by 2 to 3 cup sizes. Sorry, 1 to 2 cup sizes. How was that? Were you okay?
Yeah.
Okay. Awesome. So we're going to go. So now this is a platelet-poor plasma, and we're going to keep on injecting around the breast. Okay. Ready again? 1, 2, 3. This one tends to be a little bit more stingy. If you have nipple insensitivity, this can help with that as well. So I'm going to get some of this by the nipple. But does this feel more stingy, or is this okay?
It's okay.
I love doing breast lifts. I have done this even on myself, and I noticed a 2 cup size difference. And now it's been over, or just about 3 years. Let's see, May 2017 is when I did it. Oh, almost 4 years now. I guess I forgot about 2020, huh? Like we all want to. Anyhow, so I'm still 2 cup sizes bigger than I was back in 2017, and I did not gain any weight, which is always a plus, but that's not the reason to attribute the increased size. So there we go. And now I'm going to go a little bit farther over here. One more spot over here. 1, 2, 3. And the distribution of the PPP for our patient today, I'm doing it all on top. She wants lift, and she doesn't need any volume in the bottom part of her breast. So we're doing it all up here, which is, you can see how I'm doing it right still.
Mm-hmm.
Just being a tough little quickie here. Good job. And let me save a little bit. All right, I'm going to go just a little bit lower just for that nipple. 1, 2, 3. Sorry, you okay?
Mm-hmm.
All right, have some around there too. Some redwood. All right. So this is one side, and I'll show you. You stay here. Turn, but you can already see the difference in the one side. I didn't wipe off this side yet of its numbing cream, but you can see the difference in the fullness already. You can see all that fullness there as opposed to scoopy over here, and this is where all the PRP and PP all landed. So that's kind of nice. You can already see it immediately. And then we'll keep on doing a little bit. We'll do the other side and then we'll show you from there. We're on the other side now. Ready? 1, 2, 3. Oh la la. And then again, platelet-rich plasma is going to go in the middle. And on the top middle. And then platelet-poor plasma goes a little bit further. And you can use PRP many areas. Like I said, it'll call to the stem cells no matter where you are. So we will do PRP facials. And we will microneedle PRP into the face after numbing again, and then you'll make brand new collagen, brand new elastin. So you restructure your skin using your platelets. We could do the PRP facelift where we can inject them like we would do filler. Sometimes we do filler, and then we inject platelets. Okay, ready? 1, 2, 3, and then we inject platelets. Like in the cheeks, the nasolabial fold, and the lips. And then you can chase that filler with PRP. And again, as the filler, and it says before, as the filler breaks down, the PRP kicks in, and you make collagen right where you wanted to, right where you got your filler. So the filler looks good immediately, and then the PRP, like I said before, it takes a few months. So it's nice to have, as the filler breaks down, the PRP kicking in. So that's a PRP facelift, and then we can use PRP in the hair, in the scalp. So if you have thinning hair, we can inject it in the scalp. Okay, we're going to go up a little higher. 1, 2, 3. There we go. To help with hair regrowth. It doesn't bring back bald areas, but if you're thinning hair, if you have thinning hair or even eyebrows, if that hair there is thinning, PRP is great for that. And then there's also PRP called the Priapus shot. So that's for men. We inject into the penis to help with stamina. The PRP makes you make brand new blood vessels, brand new nerve endings. So better sexual function, better blood flow, especially if you have medical conditions that maybe your blood vessels are a little bit weakened by. For example, if you have diabetes, high cholesterol, high blood pressure, and those little teeny tiny blood vessels are preventing you from having the best sexual wellness, then we can inject PRP to help make brand new blood vessels, brand new nerve endings. One more right here. And we can also inject into the vaginal area for the same thing. The nice part about the O shot, that's the women's version, is that it also helps with stress urinary incontinence, because when we inject PRP into that area, it actually makes brand new pelvic floor muscle cells, which helps strengthen the outside. So if you're jumping on a trampoline and you pee, you have more pelvic floor muscle cells, so you're stronger there. So you tend not to lose the urine like you would have before. I'm also noticing that you have a few stretch marks. Our patient had lost a bunch of weight, so this is going to help with those stretch marks too. You can inject into scars and stretch marks with PRP to really help restore. One more, a little lower. Here we go. La 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 la. To restore the normal skin texture. So it's great for scars. It's great for stretch marks. And we'll be done here. I'm just doing around the nipple area to help with nipple sensitivity. All right. And now you can see that she has a fullness on both sides now. Beautiful. And then we're going to do some PDO threads next. But you can see how there's really no down. Nobody would know other than our patient. She's going to feel full. I've already recommended to her that she wear double bra just to help keep the girls up and help keep them together and tight, because I think it makes it feel better for the next couple days. But really, there's nothing that she really needs to think about other than just keeping herself comfortable, because there's a lot more fluid in there now than there was, 20 minutes ago. But okay, 1, 2, 3, here we go. So we still have some more PPP left, the platelet-rich plasma. So I've sat her up, and we're going to inject the areas that we see still have some deficiencies. So we're going to pump up those breasts. Woohoo! She's giving us a thumbs up. I know it's a little bit spicy. PP tends to be spicier than the PRP. You're doing awesome. Alright. And we're putting in, just so you know, about 60 cc's between both breasts, between the PRP and the platelet-rich plasma. Here we go on this side. 1, 2, 3. Hi. Hello. There we go. And you doing okay? Mm-hmm. She's just a little trooper here. Alright. Let's go here. Beautiful. I always say leave no platelet behind. Whether it be PRP, PPP, we don't leave it any of that good stuff behind. Okay. I've already drawn her for her PDO threads too. Those are coming next. Okay, 1, 2, 3. Hey, hello. How you doing? Alright. Here we go. Alright. You doing alright? Mm-hmm. We're going to feel full, but that is good. Mm-hmm. I'm going to come to the other side now. Okay. Let's go over here. Okay, last one. For now. All of this is placed above the muscles, so we're not going through any muscles. This is all in the skin. This is a nice way to not have to undergo breast lift if you get enough result from this. Sometimes people want to do 2 or 3 of them. It just really depends on the results that you get. I would say wait a few months, obviously, so you can see your full result before we decide to do more. But in terms of safety and pain-wise, this is a lot easier than doing a surgical breast lift. So good job, and you can see how quickly that scoopy area. I had scoopy boobs, so I could say the same thing. This is how much that scoopy area got better. Quick, just like that. We've already done PRP in our patient's breast to help with the breast lift. Naturally, with the PRP helping her to make collagen in the next 3 to 4 months. But she wants a lift a little quicker. So these PDOs are going to help pull up her breasts very fast. So I've already made a little lidocaine injection of lidocaine, so she doesn't feel my needle. So here, can you feel that now? Mm-hmm. There? No? Okay, cool. So I'm going to just make a little spot to help me get in, a little pilot. There we go, and then coming back out. Excellent. And now I'm going to take my PDO thread. And the first one we're going to angle right down, okay? And here we go. You let me know if you are uncomfortable. And there we go. There we go. All the way down. Now these are 4 inches long. So we got a lot of good territory it will cover. And these we can actually move around a little bit, so if I'm having a little trouble getting through, I could just redirect it. You okay?
Mm-hmm.
Excellent. All right. So now I'm going to take this little part. I hate this little thing. If anybody's watched my videos, they know I hate this little thing at the top, but it's the way it keeps the thread in. Let's re-thread it in. All right, I'm going to find the bottom right here. I'm going to push on you. Push that. Push on you. And there we go. And there we go. So our first thread is in. And she's going to get a nice lift. Now we're going to just go to the next. We're going to go through the same injection spot, if it will share its home. Let's see. So now I'm securing these into her breast tissue. I've already done a majority of the massaging that I did not have on video because it's hard to keep the nipple out. But then what we're going to do is just cut out the ends. And we're going to, I'll show you what the one side looks like. We'll have her sit up for one more second, and then we can see lift wise in a. There we go. And one more. And now what we're going to do is we're just going to pull her breast up and tuck those under. See? So again, nobody's the wiser. Except, of course, your patient. So let's take a peek. I'm going to sit up for just a second. Just without looking at your face and see if you can see. And now this side has the PDO threads with them. So you can see how that is lifted up, and this is still not as lifted. So, and then again, it's going to take a good 3 months for her to have her full results from her PDO threads. Come on down. These PDO threads last for a year to year and a half before they dissolve, and then she'll continue to make collagen that whole time.